Hi, this is Dr. Fadardi. During the past 2 decades, my research has been focusing on addictive behaviors and brain. There are so many various forms of drugs that could be potentially addictive. However, addiction does not need drugs only to develop. There are so many various forms of behaviors that could be developed into addictive behaviors. In this presentation, I would identify impact of substance abuse and other forms of addictive behaviors on the brain and how drugs work in connection with the brain's chemistry. Also, we will understand how prolonged use of drugs can change brain circuitry. We would also understand how appropriate treatment can help people recover from drug abuse or any other sorts of addiction. But a little bit of motivation about using drugs. Research has shown that people generally take drugs to either feel good, like sensation seekers, or anyone wanting to experiment with feeling high or feeling different, or to feel better, like self-medicators or individuals who take drugs in an attempt to cope with difficult problems or situations, including stress, trauma, and symptoms of mental disorder. The first group are called motivation enhancement, whereas the second group could be classified under coping motivations. Science has also generated much evidence showing that prolonged drug use changes the brain in fundamental and long-lasting ways. So let's see how these changes are. Drugs and substances can alter the brain. You can see here is a series of slides from normal brain and brains that are addicted to cocaine, methamphetamine, alcohol, heroin, a different type. However, dopamine D2 receptors, which are responsible for binding dopamine in the brain, show a reduced density in all addicted brains. Red in the left column for controls is showing a high density of dopamine D2 receptors, whereas yellow is kind of dominant color for brains that have been addicted to different sorts of brain. This suggests that overstimulation of the brain striatum where dopamines are present in providing us with the experience of pleasure have been reduced because the person is actually administrating dopamine from an external source. Dopamine transport is decreased and mental function is compromised when a person abuses methamphetamine. The brain image at the top is from a normal control. Actually is broadly lit in red and yellow, indicating the presence of many dopamine transporters. In contrast, the brain of a methamphetamine abuser, the bottom, shows much less binding in the striatum, indicating that methamphetamine abusers suffer significant reductions in dopamine transporters. But what does this mean functionally? Graphs on the right side show the impact on motor and memory tasks of this methamphetamine-driven decrease in dopamine transporters. Magnitude of the decline in number of dopamine transporters correspond to the extent of motor and memory impairment. To conclude, so far, brain changes resulting from prolonged use of drugs and addictive substances may compromise mental and motor functions. Now, let's talk a little bit about lapsing and relapsing. You have often heard of craving, but what craving exactly does to our brain? Former addicts report overwhelming urges or craving for drugs in response to cues and triggers previously associated with drug taking or any sort of addictive behaviors. I keep repeating this, which often leads to a relapse. This phenomena can be examined experimentally through PET monitoring of brain responses to videos, depictions of drug-related and non-drug-related images. The bar graph on the left illustrates strong craving induced by cocaine-associated stimuli in a person addicted to cocaine. The cocaine video increased brain activity at the bottom right image, as you can see, in two areas, the amygdala and the anterior cingulate gyrus. The amygdala is involved in emotional responses and learning. So they call it like memory for emotions, while the anterior cingulate is involved in evaluating the wisdom of and inhibiting impulsive behaviors. But what does all that mean? If we know that memories appear to be a critical part of addiction and they are strongly associated with people, places, things, and emotions, then it makes a lot of sense. So anything in a drug abuse context that is related to the behavior can act as a trigger and cause the addict or the abuser to crave or desire the behavior or the desire to repeat the administration of the substances and the drug. So we have the brain of a person here who has been addicted to cocaine use, but this person has been detoxified from cocaine for a few weeks. And researchers have shown two different types of videos to this person while this person has been put in a PET scanner. On the left, you can see the amygdala responding to a video from the nature, beautiful scenes, like flowers, birds, anything from the nature, very beautiful. And on the right-hand side, you can see this person's amygdala reacting and letting so brightly to a video which contained objects and things and items that have been related to cocaine abuse. So that memory, which is associated with emotions, can strongly cause the person to crave for using cocaine again. A very important consequence of such a change in the brain circuitry in response to rewards is that neutral rewards become devaluated in drug abusers, as drug-associated cues serve the motivational circuits. Cocaine videos activate the brain of a drug abuser more than even erotic stimuli. The bar graphs on the left show that specific brain areas in control individuals, non-addicted individuals, become strongly activated by erotic but not by cocaine-related films, the yellow bar. While the exact opposite pattern is seen in cocaine abusers, the blue bars, as you can see. These results suggest that addicted individuals have an impaired capacity to extract pleasure out of normally enjoyable activities or stimuli. To summarize our findings so far, drugs alter brain circuits and motivational priorities. So the question is how all that can be related to treatment and the cycle of addiction. It's very important to realize that addiction is not related to one single factor. It is a multifaceted, multifactorial phenomenon. Therefore, any intervention to tackle this problem also must address various reasons and various facilitators of the behavior. Whereas detoxification and staying abstinent from any sort of addiction, including addictive behaviors, is important, but it's even more important to deal with the person's functionality in his or her real life. And this type of people need to work on their motivation, their family structure, on their relationship, and the community has responsibility to reduce factors that can contribute into the development of addictive behaviors and promote factors that can help with a successful lifestyle and enjoyable lifestyle. So thank you very much for paying attention to this presentation.